Radiofrequency ablation is done to ablate or seal closed one of the veins that we identified on Doppler ultrasound as having leaky valves. As a consequence of having leaky valves, that can create reflux, which is reversal of flow in the veins. The veins are only supposed to flow towards the heart. When you have reflux in a vein, that makes you prone to have aching, heaviness, and swelling. The more that you're standing or sitting, at the end of the day, you can be really in severe discomfort. By treating this vein with the radiofrequency ablation, we hope that your legs feel lighter, less heavy, less aching, especially when you go to bed at night.
Can I go back to Kings Island?
It's nice weather today.
I could go today?
Yeah.
A few weeks ago, I stood in line for about 3 hours total by the end of the day, and I was in so much pain at night for 3 days straight. I couldn't sleep, kept waking me up, and it was just obvious. I definitely needed this done. And I noticed it last year too, but it got worse this year.
It's progressive condition.
It's definitely gotten worse.
This procedure is done exclusively with local anesthetic. It pinches a little bit, but then it's all numbed up afterwards so patients can drive home and resume normal activities for the day. An IV access is gained into the great saphenous vein, which is the vein that we identified as having reflux on the ultrasound. It's the longest vein in the body. It extends from the groin to the ankle. We'll usually treat the upper part of that vein from the groin to the knee. The goal is to seal close the leaky vein, and that diverts blood flow into the healthy pathways. I often get the question, if you're going to kill my vein, am I going to be worse off in the future? We're eliminating the dysfunctional vein. There's a whole wealth of redundant, healthy veins that are flowing properly, so sealing the unhealthy vein diverts flow into the healthy channels. So we do everything under guidance with ultrasound. Here's the picture. The skin is up here, and these white lines represent the fascia that separates the subcutaneous tissue and the muscle. So these veins that have leaky valves aren't the main veins of the leg. It's a superficial vein just below the surface of the skin, almost like a varicose vein under the surface. This is the vein here, and this allows us to access the vein easily, advance our catheter to where we need to go. Here's the radiofrequency catheter. I describe it as being about the size of a piece of spaghetti. It advances through the IV. At the very tip of it, the last 10 centimeters, those are what heat up and essentially weld or cauterize that vein. We're using thermal energy to seal that vein permanently because it's a dysfunctional vein providing no benefit and contributing to her symptoms. Here on the ultrasound, there's a circle here, and you can see a white dot moving in and out. That's Corey manipulating the catheter to where we want it positioned. And now that the catheter is in place, we are going to infuse some more Novocaine into the tissue around the vein. This bag has a mixture of lidocaine and simple saline. The fluid surrounds the vein and acts like a heat sump so that the energy is delivered only to the vein and not to the tissue around the vein, and that you don't feel the treatment and it doesn't hurt afterwards. There's a white dot, that's the catheter inside the vein, and the dark area on the ultrasound surrounding that is the fluid going in and surrounding the vein. And now we're initiating the thermal ablation of the vein. It's now heating up to almost 300 degrees Fahrenheit. The catheter has a temperature sensor in it that we can tell if the catheter is adequately surrounded with the fluid. From the room temperature fluid, we'll drop the temperature on the catheter. The catheter heats up for 20-second cycles. Typically we'll do about 6 cycles there, withdrawing the catheter segmentally. So we're all done, and we are going to put some Band-Aids over where we did the injections. And we'll put a little bandage over where we entered the vein.
No, it felt faster. I don't know if it actually was faster, but it was, since I knew what to expect, it's a lot easier.
It's kind of like when you go to a place for the second time. The drive there always seems shorter.
Yeah.
On average, we're usually about 10 minutes from start to finish. So quick procedures. These little stair strips help both heal. This access into the vein is so small, some patients are on blood thinners or aspirin, and we don't even have the patients stop the blood thinners if they're on it. We'll have them sit and rest for an extra 5 or 10 minutes to make sure things stay sealed. But bleeding from the access site is extremely rare. Very well tolerated procedure. We expect her symptoms to be improved for a young, healthy woman. The results are essentially permanent, probably 95% long-term success rate. Some patients will have some other veins have some leaky valves in it over time, and probably about a 10% chance of that. So this is a procedure on the veins where patients have to keep coming back every year or so. The next visit will be a checkup ultrasound next week.
And what is that?
We're looking at that there's no hidden blood clot. There's a less than 1% risk of blood clots, so we check for that. We make sure that the vein is adequately treated, and we look to see if there's any more leaky veins, taking a second look. So afterwards, we'll put some compression on the lower part of the leg. This vein, since it's been flowing backwards, has essentially pressurized the lower part of the leg, and her symptoms are more prominent in her calf. So this helps get extra fluid out of the leg. It helps it kind of decompress, and she takes this off after showering tomorrow morning. And that's called Covan. Very elastic, very comfortable.
Can treat that. He's very comfortable.
Good, good. She had her right leg done yesterday. This is how her leg looks 24 hours after treatment. Few bruises. She's still wearing her compression stocking.
How was your experience with the Vein Center?
It was worth it.
10 out of 10 would do it again?
Yeah.
Go to cincyveins.com and schedule a consultation today. The Vein Center of Cincinnati, your center for vein health.